Yes, we do. We have 4 of us now. We're just waiting for Alan, but we'll proceed without him.
Okay, thanks.
Thank you. Good morning. I would like to welcome all committee members, staff, and guests to the December 15th, 2025 Haldeman Norfolk Health and Social Services Advisory Committee meeting. I would like to remind everyone that our meeting is being web streamed. With that, I call the December 15th, 2025 Haldeman Norfolk Health and Social Services Advisory Committee meeting to order. Disclosures of pecuniary interest. Are there any disclosures of pecuniary interest? Seeing none. Additions to the agenda. Are there any additions to the agenda? Seeing none. Move on to adoption of advisory committee meeting minutes. 3.1, Social Services and Housing Advisory Committee, August 25, 2025. May I have a motion to approve the Haldeman Norfolk Health and Social Services Advisory Committee meeting minutes from August 25 to 2025. Thank you, Councillor Van Passen, seconded by Councillor Metcalf. All those in favor? That's carried unanimously. Thank you. Update on reports. Are there any updates on previous reports? I'll turn it over to Bill Nolan. Thank you.
Thank you, Chair Bentley. And through you to the committee, all reports presented to date have been approved.
Thank you. Under 5 is presentations and deputations, and 5.1 is Haldeman Norfolk Housing Corporation. I would like to welcome Matt Bowen, CEO of Haldeman Norfolk Housing Corporation. Mr. Bowen, you have 10 minutes for your presentation. I'll let you know when you have 1 minute remaining, and whenever you're ready to begin, you can hit the button on the right-hand side to turn on your microphone. Thank you and welcome. Good morning.
No, this one isn't working. Just gonna move this guy up. Oh, okay. It's not moving. That's okay. I'll just adjust the mic. Well, thank you, Mayor Bentley, for the introduction, and thanks all members of committee for having me today. For those of you who don't know me, I think most do, I'm Matt Bowen. I'm the Chief Executive Officer of the Haldeman Norfolk Housing Corporation, and with me today is our Director of Development and Capital, Mark Pipe. I'm here today with a request. Our Board of Directors put forward a motion approving 2 full-time staff equivalents at the Haldeman Norfolk Housing Corporation. Today we'll be focusing on the project manager position. I believe we have a slideshow here. Perfect. Will I just note for next slide? Perfect. Great. Thank you. So just a bit of context, the Haldeman Norfolk Housing Corporation just celebrated its 50th year providing community housing in both Haldeman and Norfolk County, which we're extremely proud to do. I had the privilege of joining the organization in 2019, so I've celebrated just on my 6th year here. So I think sort of the area that I want to focus on is just the exponential growth that we've really been privileged to have. And I want to say that growth happens as a result of this committee and both councils. So I want to thank everybody for your support. And just a little bit of demographics about H&HC. We do provide 68% of the community housing in both counties, and that works out to be about 77% of all the rent geared to income that's available in both counties. Our current assets are valued at $1.12 million. And if you have a look at the slide presentation, you can see that we're really privileged to serve the community's most vulnerable. You know, the large percentage of people that we do house are either on ODSP, Ontario Works, Old Age, or CPP. There is a small and, you know, sort of trending upward cohort of folks where employment income is utilized, but again, for the most part, you can see that that the folks that we do serve are the community's most vulnerable. Of our portfolio, over 50% are seniors and older adults. 22% represent family households, 14% single-family households. And you can start to see where across the continuum of housing, this is sort of some of the areas that HNHC has moved towards. We do have some transitional units, and we do have a small partnership with Norfolk General Hospital and the Canadian Mental Health Association providing supportive housing. So, there is sort of a changing landscape at HNHC in terms of who we're serving, which is, I think, just a great reflection of us responding to the need of the community. Next slide, please. So what's changing at HNHC? Why is Matt here today? Like I talked about, the exponential growth in the organization. We're seeing it on a lot of different areas, and I know that there is a very robust business case and accompanying staff report. But from HNHC's perspective, we're really here to talk about the growth that's occurring in our capital budget. So you can see the numbers there, but to put it in perspective, in 2013, our capital budget was around $450,000. And then when I joined the organization in 2019, I've always seen it at about $625. But through the grace of committee and councils, we were approved, not guaranteed, but approved for a capital increase over the next 15 years. And our capital budget will move from $625,000 to over 2.6. More importantly, in the interim, we'll see a $625,000 capital increase rise to about $2 million in the end of 2027. So that's almost 3 times the size of the original budget, and we're doing that with the same staffing complement that we have. So the repair and the renewal, I want to focus a lot on that because that's an acute funding stream. That's going to end by the end of March 31st, and we're well through that. We're over 95% committed and spent. So that $8 million repair and renewal funding is excellent because that was a large capital boost to our assets that has made a significant difference. And with the support of both counties and staff, we were able to do that in-house. But that's where we really started to see the pressure in terms of the workload on the staff. And when we look forward to future planning and that capital budget tripling, we just understand that with the new developments underway, specifically in Dunnville and Delhi, and starting the preliminary discussions around Port Dover, that with one staffing person essentially overseeing that entire envelope, it does put us at a bit of a vulnerability. So there are a lot of different aspects. The new developments will provide different technical services in the future when they are brought online that are much different than buildings of 50 and 60 years ago. So the procurement of those services, whether it's energy management, building automation, and other systems, will require a different way that we procure that and manage those through our capital envelope. And then again, one of the things that I do want to point out is that HNHC hasn't had a staffing increase since 2013. So even though we've been very fortunate to significantly increase our operating budget and our capital budgets, we've done that with the staffing complement that we've always had. And to give you a bit of history, when I joined HNHC, we actually had 12.5 as our staffing complement. And as a part of our reorganization with our board of directors in 2019, we reduced that number to 12, and we actually reorganized the way that we did things so that we could be efficient. And one of those efficiencies we created was the CEO actually had a full-time administrative support person, which was Louise Jones. The name really isn't that important other than just trying to draw the line here. And we did put that role back into the pot to create a continuous improvement program. So, that support was put back in again to strengthen the organization. So we have done a lot internally to sort of utilize the positions that we have to be in the best position possible. And I think that initial alignment in 2019, rolling out in 2020, positioned us to be able to take on a lot of this work. But when I look for the next 10 years, we see a significant challenge in our work environment, certainly. And again, this is our sort of our perception, our reality, especially on the capital side and the support services side. So that's why, working in consultation with the board, that's how we came up with those two positions. And again, today, just speaking directly about the capital position. Next slide, please. So how this position will have an impact at H&HC. So when we looked at the business case, we were looking in the moment, but moving forward, how does this support the organization? This position, in our opinion, will support the growth and modernization. It will facilitate the organizational growth that we have and the modern technologies that we're building into our housing portfolio. One of the big pieces of our work at H&HC is tenant engagement. So we really believe by having this dedicated person, we will be able to increase engagement and communication. And we really learned that these last projects, multiple projects. I mean, we're very fortunate to have the opportunity to have all that money to do that, but multiple projects and multiple buildings at multiple times really disrupts tenants' lives. So one of the focuses we had was to deploy all staff to make sure that our communication was as good as it could be, and that tenants had an opportunity to participate in some of the changes that were going to happen in their building. And it's a great model. A lot of people talk about tenant engagement, and it does have so many great impacts. But I think the one piece that people don't see is, how much effort has to go into if it's truly going to be meaningful and impactful. So that's one of the areas that we'll see improvement. Oversight and efficiency, centralizing the capital planning, the oversight of that. Like I said, Mark's here with me today. He is the only individual in the organization currently at this point. So when we look at succession planning as well, one of the key pieces that we're looking at in our strategic plan renewal that's going to happen next year is that succession planning and resilience piece for the next 5 years. So this position will also ensure that we have technical resilience and that succession capacity and future readiness. The amount of work that goes into the alarming systems and the building automation and the programs that have to go into the technology of these buildings.
You have about a minute left, Matt.
Okay, require a lot of support. So with that, I'll just move on to the final page. And that is sort of, again, there's a lot of ways to do this, but working with our board, working with our team, we looked at two options. To fund this position specifically, the capital project manager could be funded directly through the levy, through approval of the shared services budget process with a levy impact of approximately $115,000. And then there's option two, and this is the one that that we're recommending today, is that although not fully supported by staff, and there are different ways that Norfolk County handles their capital budget versus Haldeman County, is that we fund this position through the existing 10-year capital plan, which in all capital plans, there is a portion of that budget that's set aside for project management fees. Although we would still use project management fees and consulting fees, we would look to reduce that. But what we're asking is that we can reallocate a portion of the project management, a portion of the capital budget to cover off the project management. So that will mean a slight reduction in the number of projects overall. I want to be clear about that. We will do less projects on either side, but we also have a commitment to this committee that we will seek out grants. We will seek out ways to offset that cost. But really, those are the two options that we have here today. If there's other ones, I certainly open to those, but that's what we have to present today. And I want to thank you for your consideration and your time.
Thank you, Matt. I appreciate your presentation today. I know it's really tough to stretch out those dollars and make it work for everybody. And I know the Haldeman Norfolk Housing Corporation has a lot going on. And we thank you for the services that you provide to our communities. With that, we'll move on to our staff reports. Thanks, Matt.
Okay,
Have a great day.
Thank you.
Staff report 6.1, Finance. Amy Verspini is here, Supervisor of Financial Planning and Reporting, and she will present this report, CS 25176-2026 Budget Discretionary Request. Thank you.
Good morning, Chair Bentley and committee members. I am presenting the discretionary report. This report seeks to provide advisory committee with the Haldeman Norfolk Housing Corporation's request for additional staffing with a focus on the immediate position impacting the 2026 operations and provide additional information for consideration. H&HC's Board of Directors has approved a request for 2 permanent full-time positions, a project manager beginning in 2026 and a tenant support worker in 2027. Prior to the request for the project manager, H&HC had not indicated at the time of the CMHC repair and renewal project or at the additional of the 2 new facilities that additional staffing would be required. Staff have identified a number of risks, uncertainties, and some potential benefits of the program manager request. As Matt noted, the CMHC project is winding down with the last of the projects being completed now, with final reporting due in Q1 of 2026. They've spent close to $8 million split between grant funding and municipal funding, and the work has been completed across the portfolio. In anticipation of the new facility builds in Dunville and Delhi, H&HC started selling properties in the spring of 2022, with 23 older units having been sold, 2 demolished, and 2 more currently listed for sale. These are significant changes to the facilities within the portfolio, and it would be prudent to undertake an updated facilities condition assessment to understand the current needs of the portfolio after all of this work, as well as a revised capital plan based on the updated information. This would also help determine if the position is needed. With the 2 new builds as well, they will change the day-to-day maintenance and management needs as they are brand new apartment buildings versus the aged old semi and single homes that they are replacing. The construction of these projects are also under the guidance of contracted project managers. While noting this fully does not alleviate the project management burden from H&HC, it does relieve some pressures. All that said, internal project management can improve efficiency, communication, tenant relations, and increase in-house knowledge, potentially reducing the need for external consultants in the future, as well as supporting long-term organizational capacity and succession planning. Today's presentation and the approved business case suggests that the position be paid from capital plan funding. If that is the case, the capital plan presented, as Matt noted, would require projects to be moved to the future, delaying much-needed work, or it's not accurate to the needs of H&HC and the capital plan is more than what is needed. However, whether the FTE is funded from operating or capital allocated funds, the source of the funding is the municipal levy. As noted within the report, public sector accounting standards state tangible capital assets must be recorded at cost, where all the costs have to be directly attributed to the acquisition, construction, development, or betterment of the asset. Project management should not be classified as a capital cost unless the associated cost can be directly tied to specific projects. It appears that this position should be classified and funded through operations. As Mark noted, Norfolk County's best practice is alignment with standards, and it is not to fund permanent ongoing staffing positions with capital dollars. Although Haldeman County's accounting principles differ slightly from Norfolk's and they fund direct staffing costs from their capital levy, however, the project administration has to be tied directly to a specific capital project. And as the position proposed does not appear to allow for that type of direct accountability and tracking, the staffing costs from Haldeman would also be funded from Haldeman's operating levy. Staff are recommending that the request for the additional FTE be denied or deferred until additional analysis of capital future needs are decided, operating needs, and the financial impacts are identified. Thank you.
Thank you, Amy. Do we have questions from our members here? Comments? I guess I get to put a motion on the floor first. So may I have a motion that report CS 25176, e-scribe agenda package be received as information at the Haldeman, the Health and Social Services Advisory Committee does not recommend the Haldeman Norfolk Housing Corporation's budget request for 2026, and further that the request is included in the list of discretionary budget items presented at Norfolk County Council Budget 2026 Budget Committee meeting on January the 21st. May I have a mover and a seconder, please? Moved by Member Metcalf, seconded. Anybody wants to second this? No? Oh, yes. Thank you, Councillor O'Neill. Do you want to have discussion now that the mover and seconder's on the floor? Discussion, Councillor Van Riesche.
Thank you. Yeah, I have lots of questions. No, I can see the need. I really do. Maybe not for both, but maybe for one. To me, it's all about how we're going to finance this. And because there is the difference, I think this question is towards finance. If there's a difference in the way that accounting is done in Haldeman versus Norfolk, but yet at the end of the day, it would have to go to Norfolk Council to our budgetary meetings in January. Is there a possibility I don't think there is. Correct me if I'm wrong, but we've had all presentations done for budget already. Am I correct in saying that?
Through the chair, yes. The Budget Committee on October 16th is generally when all of the presentations were made to ask for additional funding.
Okay, is it all right if I go back and ask Matt a question then?
Yes, you may.
Thank you. Matt, you didn't present this at budget time when we were taking presentations, did you? Not that I can recall.
Through you, Madam Chairman, to you, Councillor Vanderich, no, I did not. We were still in the planning phases of this process. I did have a meeting with Ms. Van Dyke and Mr. Merritt many months ago to sort of start the conversations of how we would navigate this through the shareholder agreement. But to your question, no, I did not attend in October to present this.
And how did you think you could put it through the capital versus the account, the financial end of it? How did you think that we could do that? Did you possibility that we could draw that money from the capital?
Through you, Madam Chairman, to Councillor Van Der Rishi. Yeah, I did, based on some preliminary discussions around how Haldeman County utilizes and accesses their capital funds for positions. I know it's different in Haldeman and Norfolk, and our position is always to we utilize policies from both counties as the representative of both counties. But so we really, our board and our team saw it as we recognize that there would be a reduction in the number of projects overall up to that $115,000 on the potential $2 to $2.6 million over the term. But we felt like we would be able to recover some of those costs through the project and project manager costs that are inherent anyways in all of these projects. Like I mentioned, industry standard is typically 5 to 10%. So we wouldn't be able to eliminate that altogether, but where we could reduce that, we would, and where we could go after grants and other administration efficiencies, we would, to sort of offset that. But to be completely transparent, there would be a slight reduction in the total number of projects over the 15 years that would occur. But that was our methodology behind that.
Okay, thank you very much for that. So at the end of the day here, what I'm going to say is I'm not going to support this motion for the simple fact I think there's a need here. How we get to it, I don't know how. But at the end of the day, we have so much going on now between both counties with more additional housing going to occur. And you are so low in staff, Matt, for this operation to take place. We have to do something. So I am going to not support this motion and see if we can make a motion that we bring it back to for reconsideration in January with our budget process. So that's all I've got to say.
Thank you. Amy has something to add to that. Thank you.
Through the chair, I just want to say it will be coming back to budget. It will be in the discretionary report at Norfolk County's budget meeting already on January 21st.
Councillor Van Passen.
Yes, thanks, Madam Chair. I think, too, that a position needs to be created here. Now, I do have a little issue with the job title of a project manager. I think we're more in need of somebody who still wears a tool belt and knows how to use it. We have a bunch of 1970s buildings that need a lot of work, and now we're getting new builds, and technology has changed as well, that the electronics and like the old buildings I can fix, the new ones I can't. They need a laptop instead of a hammer and a screwdriver. So to fill a position is one thing. To call it a project manager, I think gives it the wrong sense of what I think we really need. And yeah, redundancy, and we're increasing the number of facilities that we are going to be offering over the next few years. We've got some new builds that need special treatment, but we still need the guy who can get out there and fix the broken door in the front of the building. And so to call it a project manager position maybe is the wrong name, and maybe it gives the wrong impression. But I wonder if Matt might want to comment on, what is the actual intent of this position? Not somebody to sit behind a computer screen and look at stuff, or is it somebody who's going to get their hands dirty?
Madam Chairman, through you to Councillor Van Passen. I'd say it's a bit of a hybrid. They definitely won't have a hammer, but in the digital world, today's hammer does look more like an iPad. But to be completely transparent, the sort of premise of this position would be somebody who we're focusing on the developments, and that's great, but we're really focusing on the 625 to 2 million, those day-to-day capital needs that were outlined in our 15-year asset management strategy and our capital plan. So this person would coordinate a lot of the construction work that would go on. That's just the way that it goes on the capital side for the most part. There's smaller projects that we can do internally, and we do, but jobs over 10,000, 20,000, 50,000, we follow the procurement policies that we have in place. So the majority of this role, although the individual would have devices like currently Mark will monitor the building automation systems and the control systems, and he has to go out and do and fix those things, not necessarily with a hammer, but that is a component of the job. But for the most part, this position will be somebody who can, and it doesn't have to have the word manager, it's just somebody who can coordinate the increase in capital jobs and the day-to-day operating tenders and all of the work that we do to fulfill the spending of that money.
So if I could follow up on that, Madam Chair, I know from my experience with Norfolk County, over the last few years, we've approved capital projects that are not being done because we lack that supervisory capacity, that there's just too much work for the staff we have to do. And it seems like the Housing Corporation is going to fall into that same little trap. And I also, from the history of Norfolk County, we went through the experience where we were funding operations out of capital budgets and capital reserves. And all we managed to do was drain the reserves down to zero, run out of money for capital projects because we weren't putting it on the levy where it should have been. So, two parts to my little rant this morning. We need this position, and it needs to be funded from the levy the way it should be, and not try to go through a backdoor method of stealing that percentage. Now, when we do have capital projects, yes, we do allocate that money, but you can shift that back over after the fact where it's needed, and not solely try to fund a position out of that in the first place. So yeah, again, I can't sort of support the motion that's recommended by the staff. I think we need this position, needs to be funded from the levy, and let's present that at the budget meeting in January and see where it goes from there. But I would hope that this committee would support that resolution. So I'd be happy to put forth a motion that takes out the two highlighted words in the one that's in the staff recommendation, and move this project forward, or this position forward to the budget discussions.
So we have a recommendation on the floor. I think we have to vote on the motion now on the floor. So can I get, Councillor Duthie, do you have a question, comment?
Thank you, Madam Chair. I think I'm happy for you to call a vote on this one and discuss on the next item.
Okay, thank you. So we do have a motion on the floor, so we'll defeat it and then we'll put your motion on the floor then, Councillor Van Passen. So all those in favor of the motion that is currently on the floor, all those in favor? I see no one in favor. All those opposed? Opposed? It's defeated unanimously. So now, Councillor Van Passen, you have a motion that you want to put on the floor?
Yeah, I will steal it from the report. The motion would be that report CS 25-176, 2026 budget discretionary request be received as information, and that the Health and Social Services Advisory Committee recommend the Haldeman Norfolk Housing Corporation's budget request for 2026, and further that the request be included in the list of discretionary budget items presented at Norfolk County Council's 2026 budget meeting on January 21st.
Thank you. We have a motion on the floor. Can I get a mover and a seconder, please? Moved by Councillor Metcalf, seconded by Councillor Duthie. All those in favor? And that is carried unanimously. Thank you. We'll see you at budget time, Matt. Have a Merry Christmas.
Yeah, Merry Christmas, everyone. Thank you.
Norfolk Shared Services Operating Budget. Michael Vansickle, Senior Financial Analyst, will present this report. Thank you.
Thank you, Chair Bentley. Good morning, Advisory Committee members. This report, along with the supporting appendix, provides committee members with the draft 2026 operating budgets for shared health and social services programs between the two counties. This includes the Ontario Works, Children's Services, and Housing Services programs. We've also included the Haldeman Norfolk Housing Corporation, excuse me, separate from Housing and Homelessness Services this year to provide committee members with additional financial information for each of these areas. For this presentation, I will be referencing the appendix. However, if there are any questions on the report, I would be happy to take those as well. For the combined operations or the shared services summary, starting on page 2 of the appendix, the total proposed levy increase is $1,147,400, or 13.4%. The cost share for this impact is $610,800 for Haldeman County and $536,600 for Norfolk County. The first departmental discusses Ontario Works. The request is for an increase of $176,000, or 7.6%. The Ontario Works program is overseen by the Ministry of Children, Community and Social Services. Administration costs are funded at 50% to a capped allocation. Employment-related costs are funded at 100%, also to a capped allocation, and all other program costs or client benefits are funded at 100%. Municipal costs are determined based on the location of the client. The ministry provided additional funding for this program in 2025. However, based on early communications with our representative, the expectation is that funding will be status quo in 2026. Thus, any increases in expenditures are on the shared levy. The largest levy driver this year is for salaries and benefits. One FTE has moved to Ontario Works from Emergency and Social Services Admin, a leading case for the overall decrease in the net interdepartmental charges as it used to be charged through there. The cost share calculation is completed based on the most recent information, with Haldeman's forecasted share increasing by 1.02% for 2026. The next department is Children's Services. The requested levy increase is $97,100, or 19.2%. The programs offered in Children's Services fall within the scope of the Ministry of Education. The cost share for administration is now 50% provincial and 50% consolidated municipal service manager, adding burden to the municipalities from the previous minimum levy contribution formula. Program cost share remains unchanged from the prior year. One-time funding, which was used to offset this shift in cost share for administration, ended, driving the levy request for this year. To help mitigate this, staff have utilized funds previously allocated to programs towards administration, which was not required before the cost share changes. Due to surplus spending in prior years, there is no service level implication from this change. The municipal cost share is based on the location of the center for most expenses and the location of the child for fee subsidy. The share has shifted towards Haldeman County by 3.98%. Next, we have Housing and Homelessness Services, overseen by the Ministry of Municipal Affairs and Housing. The requested increase is $168,600 or 7.5%. Administration costs continue to be 100% levy funded, with any available program funds used to offset the levy. Housing provider operating budgets are also levy funded, with mortgage costs funded by the federal government. Programs remain 100% funded by the provincial government to a capped allocation. Limited administration funding for the homelessness prevention program drives the levy request this year. The shift in interdepartmental charges has increased levy support for administration, with only a slight offset from the increase in the COCHI program. Housing provider budgets continue to decrease as the end of mortgage is reached, and 3 providers are due to reach that in 2026. This has also slightly offset the levy request. Finally, the Haldeman Norfolk Housing Corporation wraps up the department budgets starting on page 9. HNHC is funded by the municipalities, with federal mortgage funding used to offset these associated costs. A 4% operating budget increase has been factored in based on the previous repair and renewal report. Property tax estimates for the following year factor in with the current amounts paid by HNHC. Capital increases, as approved by both councils, have been included as well, leading a net request of $705,000. $705,700, or 19.9%. Note that this does not include the additional request presented by HNHC this morning. The cost share for housing and homelessness, inclusive of the Housing Corporation, is based on the location of housing provider units and has shifted towards Norfolk County by 1.56%. That concludes my presentation, and staff and I would be happy to answer any questions. Thank you.
Thank you, Michael. I have a motion that report CS 25178, draft 2026 Haldeman Norfolk Shared Services operating budget be received as information, and that the levy supported amounts for Ontario Works, Children's Services, Housing and Homeless Services, and the Haldeman Norfolk Housing Corporation be endorsed for inclusion in the draft 2026 levy operating budget for Norfolk County. Mover and a seconder, please. Moved by Councillor Van Passen, seconded by Councillor Van Riesche. Discussion? Councillor Van Passen?
Yes, thanks, Madam Chair. I don't think we have much option other than to approve it, but I am always confused how all these programs are 100% funded by the province, except they're capped, and we get to pay the difference. So maybe we need some discussion with the province, because they need to use language that I understand, because 100% funding, I know what that means, but the cap part I'm not quite sure of. So.
Thank you for that. Councillor Metcalf?
Thank you, Madam Chair. It's 100% of their share is what they mean. Again, the province talks about housing and affordable housing and housing units. I think it's time that they step up to the plate. Again, Councillor Van Passen, that they need to make sure the funding is there for the needs of our residents, and also our corporation that also handles a lot of the maybe some of the provincial programs are putting, or provincial policies are putting people into these situations rather than dragging them out or giving them a handout. So we're always open for more money to be funneled this way. That's all. Just a comment.
I agree, Councillor Metcalf. There's only one taxpayer. We seem to be really putting strain on them, that's for sure. So with that, all those in favor? And that is carried unanimously. Thank you. Next one is communications, and it's 7.1.1, homelessness services and response information bulletin. Brian Davis, acting chair for social services and housing, will speak about this communication item. Thank you, Brian.
Good morning. Through the chair, as we go through the winter months, the homelessness team and I felt it was useful for you to have information bulletin about the emergency housing and shelter supports that we fund, as well as describing our collaborative response for those living outdoors, often together in encampments. Those partners include the OPP, Parks and Rec, and bylaw enforcement. So the bulletin explains who to contact, how to access services, and basic information about what to expect when using those services. So just to be clear, this is not the document that we use when we engage with community members who need the service. We have a pocket-sized laminated card for that purpose. Currently, there is approximately 146 individuals identified on our by name list. Feel free to pass this information bulletin along to community members who are also concerned about the issue of homelessness in our communities. If you have any questions or wish to let us know about an encampment in your area, please email us at housing.@hnhss.ca. So with that said, I'll open it up to any questions.
Thank you. Before we get to discussion, I'll put it on the floor. May I have a motion to accept the Homelessness Services and Response Information Bulletin as communication, please? Moved by Councillor Metcalf, seconded by Councillor O'Neill. Any discussion? Councillor Van Riesche?
Thank you, Madam Chair. And I have a couple of questions. Do they necessarily have to, that we refer to encampments or individuals that can try to access these services? But I'm finding that, I don't know about in Haldeman, but in Norfolk here at our building, right downtown by the library here, we have a lot of folks that hang around there. And is it, and I know we use the Star Motel, I think it is, out that way. Are you finding that people don't want to accept the service, or find that that particular location is too far away? And I know we have a few others here, but not everybody can be housed in one location. What are your thoughts there on how we're doing?
I have Louise Lavelle with us, who's online. I think, through the chair, to Councillor Van Riesche, I think it would be good to have our program manager of homelessness respond to that question, if you don't mind.
Not a problem, not a problem.
Yeah, Louise?
Good morning. Through the chair to Councillor Van Riesche. Your question is a good one. I don't have a definitive answer as far as quote unquote how I think we're doing. We certainly are utilizing our provincial dollars and stretching them to the absolute maximum that we can to try to create as fulsome a suite of services as we can available to meet the varying needs of our vulnerable population that are experiencing homelessness. At the moment, we have two core programs. We have the STAR, as you mentioned, which is emergency shelter, and it includes housing support on a daily basis to help these folks get rehoused. And we have the warming center that's operated by Church Out Serving, which we've worked very closely with this year to expand their service with some one-time funding so that they were a 12-month-a-year service this year for the overnight. And we've also included some funding for a day program to pilot for them this year to address the concern that you're mentioning, which is that people are, hanging out, quote unquote, around the cab building. So again, we're certainly doing our very best to try different strategies and try to create different programs within the current funding envelope to do the best we can to address things and try to be nimble and flexible to respond to changing needs.
And I can understand all that, and I'm not familiar with it, so if you would explain it to me, I would really appreciate it. So these individuals are out there, they've found somewhere to sleep or whatever, and sometimes they're out there all night waiting for the library to open. But the facility we have, or we help support at the church, is there are they allowed to come in there just to meet, have a coffee, socialize, whatever, get warm is realistically what they're trying to do like downtown, or is there a certain time it will open? I'm not familiar with it. If you could explain that to me, I would really appreciate it.
For sure, no problem. Through the chair. The day program that I mentioned, so Church Out Serving's nighttime program is open 8 p.m. to 8 a.m. and users of that facility are expected to leave at 8 a.m. and they, like as you say, they have to find something else to do during the day. The day program that Church Out Serving has piloted is 3 half-days a week where people can come and do exactly what you've said. They can make appointments to meet with other service providers, which include us and our teams, to have rehousing conversations, or they can have meetings with addiction counselors or mental health services, or they can just hang out during the day and have social time with, you know, friends and peers and things like that. So Church Out Serving has piloted 3 half-days a week, Mondays, Tuesdays, and Saturdays. The same facility at the church is open from 8 a.m. till I believe it's 12 p.m. So at least 3 half-days a week, there is somewhere for these individuals to congregate during the day.
Okay, I think that's a portion where, because in my mind, for them just to sit in front of a building and just try to keep warm is difficult for me to see. It's something I think if we had a facility that they could go into, or somebody that provides something even at the library where they congregate or whatever, and I know that's an issue at the library and I understand all that. But at the end of the day, these people they're doing their congregating in front of CAB there at those, where the picnic tables are or whatever. And I mean, it's not a healthy spot for anybody to be in all day long. So I'm just wondering if we're letting people fall through the cracks, if there was something we could offer somewhere that they just sit on a chair and drink a coffee and talk to somebody. I mean, it's so profoundly frustrating to see people just wasting away is my concern. I really feel bad about that. But yet, I have to get into CAB, and I hate stepping over people, of which I've done several times. And so it's so the whole thing is so unfortunate, and I know it's all about money, but I'm wondering if working with the church, if there's something more downtown that they could get to. But anyway, it's a sad situation. I'll let others comment. Thank you.
Thank you. Councillor Duthie, sorry.
Thank you, Madam Chair, through you and to staff. Brian, thanks for sharing this piece. I think it's important that we get that out there as much as possible. Louise, thanks for your comments. I wonder, I get the sense that the day programming through Church Out Serving has been quite successful. And what the capacity, I mean, it's interesting because I think there are different groups of individuals that would use that versus those that use the community hub that's on Robinson Street. And I think obviously there are different supports needed for different types of people based on their background and the current situation in which they're living. But I guess my curiosity is what capacity we may have to help facilitate an expansion of programming, day programming in the area.
Through the chair, just to respond to Councillor Duffy, essentially we've and I'm looking at Louise. We have spent all of our homelessness prevention funding to stretch it. So we've been able to have Church Out Serving extend a day program, 3 half-days a week. We would have to look at levy dollars in order to look at expanding it further.
I guess, Madam Chair, if I may, how, and it's not a report on this, so I guess I posed the question not for a response, more rhetorical than anything else. I believe that day programming is a very intrinsic part of working on a solution to this. Not that it's an easy fix by any means, and that there is a specific solution, but it's a part of the strategy towards it. But I wonder if we should be having a more fulsome discussion around what's working and what's not, because I feel like we are investing there in helping Church Out Serving with something that is really actually working and there's real tangible result to that, and perhaps maybe spinning our tires on some other things. Again, I pose that as rhetorical and not looking for a response, but I just really want to make sure that we're spending our dollars as wisely as possible, and because the needs do change and the environment itself does change. Again, I'll leave it at that. Thank you for the comms piece.
Thank you. Councillor Van Passen.
Thanks, Madam Chair. I know I have said this many times at this committee, but it seems we're always dumping the money into the symptoms of the problem, and we're not putting enough into the sources of the problems. And I think Councillor Duthie's idea that have a more fulsome discussion someday, we'll see if we can reverse those and try to get the funding where it solves a problem, not just treats it.
Thank you. Great discussion. I appreciate staff providing this information as well, especially during this time of year. We do have, people that reach out to our councillors, to our counties and ask where they can go. So this is a great resource, I think, for all of us to have on hand. So I appreciate you bringing this forward. As for yeah, I agree with Councillor Van Passen. Maybe you need to look at encompassing where our resources are going and how, how we're going to be able to assist with the problems that we have at hand. Mental health, addiction, the list goes on and on. And some folks some of them are so entrenched and living homelessness, it's entrenched in them, and they are afraid to go anywhere else. So it's maybe trying to get into their psyche to say that it's a safe place to go at night, to welcome them. So I don't know how we fix that, but thank you again for the information. Councillor Metcalf.
Yeah, well, thanks, Madam Chair. While we're on the subject, I know this is a temporary fix, but we seem to have gone right from balmy October to mid-January with the extreme cold. And just wondering what's out there. Are there any, dedicated warming spots or places that when it is extremely cold, where people can turn to? I know the health board has issued some extreme cold warnings over the evenings, and just maybe, it's a temporary fix, of course, but with the extreme cold we've been experiencing, and probably will now that, we get into January and the colder months, and just to see what's out there. Thank you.
So Councillor Metcalf, on the second page there, Emergency Warming Center Shelter Program. It's operated by a church out serving Home for the Night program. It's First Baptist Church at 129 Yonge Street, just off of Talbot Street. And it's funded permanently between October 1st and March 31st.
I guess that's great, but what if you're, in Dunville or Cayuga or Caledonia?
No, we need one in Haldeman, that's for sure.
I guess that was my point, is that.
I often say that
yeah.
we just can't take them to Simcoe and drop them off. So, yeah, I agree with you, Councillor Metcalf. It'd be nice to have one in Haldeman County for sure. Any other comments or questions? With that, I'll call the vote. All those in favor? And that is carried. Thank you. There's no other business. The next meeting is Monday, January 26, 2026. Move to adjourn this meeting at 10:24 a.m. Mover and a seconder, please. Moved by Councillor Metcalf, seconded by Councillor Van Passen. Any discussion? We are adjourned. Thank you.
Merry Christmas, everybody.
Merry Christmas.
Take care.